Cecilia Essau, who's a professor of developmental psychopathology and the director of Center for Applied Research and Assessment in Child and Adolescent Wellbeing at the University of Roehampton. Dr. Essau is also an advisor to the United Nations Office on Drugs and Crime and on the development and the dissemination of TreatNet family intervention for adolescents with substance use disorders. As you can see, Professor, we're quite fortunate to have Professor Essau with us this afternoon, and I will let her kick off. Thank you. Over to you.
Okay, thank you very much for inviting me to be part of this conference. I have enjoyed so much since this morning. So the title of my presentation today is Cultural Aspect of Anxiety Disorders in Young People, so implication for treatment. Could you move to the next slide, please? So this is kind of an overview of my presentation today. I'm going to be talking about what we know about anxiety in young people pre-COVID and also during COVID period. I'm going to talk very briefly about our work on cross-cultural aspects of anxiety, and then go on talking about an intervention program called Superskills of Life that we developed and which is widely disseminated in 18 countries worldwide. And then with that, I'm going to be talking about some of the challenges, but also opportunities in transporting evidence-based psychosocial intervention to different cultures. Next slide, please. So anxiety disorders, what do we know about anxiety disorders? We know that anxiety disorders in children and adolescents are very common and is also serious. We know that approximately 10% of children and up to 32% of adolescents in the general population are affected by anxiety disorders. We also know that it's a complex disorders, tend to be more common among girls than boys. There are a lot of speculation why this is the case. Some suggest that it has to do with socialization, so the way in which parents raise those children. Some also suggest that there might be some hormonal, it might be related to hormonal cycle, and yet there's some studies that shows that girls tend to be more prone to traumatic events that would then lead to anxiety disorders. We also know that anxiety disorders is significantly associated with impairment in various areas of life, so emotional, social, and academic development. Next one, please. Next slide. What we also know is that anxiety disorders comorbid very highly with other disorders. But what it really means, we don't really know. So if young people have anxiety and depression, the likelihood that they have, if they have anxiety, the likelihood that they have other disorders is very high. So in most studies, it's about 75%. But the meaning of comorbidity is really unclear. And this is one of the recent papers that we have where we use latent class analysis to look at over 10,000 adolescents. And from here, we can see that there are 3 different clusters of disorders. So we have one with is categorized with emotional class. So these are the children and adolescents that have a high comorbidity of anxiety, depression, and intermittent explosive disorders. And then we have another group, what we call behavioral comorbidities. So these are the group that have substance use and behavioral disorders and also depression. And we have the normative group. Can we move to the next slide, please? So as I mentioned before, we don't really know what comorbidity actually means. Some people said it might has to do with our classification system because we have different kind of of disorders, but then within the disorders, you know, there tend to be overlap in the symptoms. Some people said it might be related to different risk factors. So in this analysis, a paper came out last year, we used symptom network connectivity approach to look at the different disorders and try to find out the dynamics between these disorders. So here in this particular paper, we look at major depression and social phobia. And what come out from here is low self-esteem. And we have another paper which is under review. It also, where we look at anxiety, depression, GAD. In that paper, we also found low self-esteem and worry to be a very important symptoms that link these different disorders. Next page, please. Next slide, please. Okay, what we know also through various longitudinal studies is that when anxiety disorders start quite early in life, and if they are untreated, they tend to be chronic, and they tend to also increase the risk of developing other mental disorders in adulthood. Next slide, please. So this is one of the studies that we conducted some years ago. This is a follow-up study, 16-year follow-up. So we assessed these young people twice during adolescence, and then one time when they were 24 years old, and then one time when they were 30 years old. So what we did here was we divided the age of onset of these young people developing anxiety disorders at 11 and below, and between 12 to 18 years old. To our surprise, is that those participants that have their anxiety the first time during the adolescence period, they were actually the one that have a more negative outcome. So the fact that they have anxiety disorders during adolescence for the first time increase their risk of developing anxiety, depression, drug and alcohol at the age of 30. Okay, next page, next slide, please. So we also look at the psychosocial impairment, and here we can see also that those that have an anxiety within adolescence onset tend to have a poorer physical health, poorer adjustment at work, have more problems within the family, were less satisfied with their life, and have more chronic stress and poorer coping skills at the age of 30. Next one, please. So that was all pre-COVID. So we also did some studies during the COVID period, during the lockdown. And here we were quite interested to find out what happened in the family. So here we have 927 caregivers in the UK. So these families have children aged 5 and 11. What we found out that here is that there is a very significant correlation between caregivers' level of psychological distress and most of the children emotional and behavioral symptoms during the lockdown. So we have 23 symptoms altogether, and 20 of them were highly correlated. And we also asked the caregivers how it was, how it is to live together, not being able to move out of the house during the lockdown. And again, here, caregivers that reported that they have, a lot of tension within the household, that 22 out of the 23 symptoms we asked were highly correlated. Next one, please. In another study, we were quite interested to look at adolescents' addiction, and we asked, this one is particularly for adolescents. What you can see here is that the number of hours that the adolescents spend during the lockdown was much, much higher than the one before the lockdown. So significant differences in terms of number of hours they spend during social media site, gaming, streaming services, and shopping sites. So we have, of course, this study is cross-sectional and we have no control really about what happened before COVID. So we have another paper that is under review right now where we use the Millennium Cohort Study. So as some of you might know, Millennium Cohort Study was done from 2001 and then they have until 2018 where the adolescents was at the age of 17. And then during the COVID time between March and May, they actually did a survey specifically looking at the impact of COVID. So we were able to analyze and look at different profile of the adolescents at the age of 17 and find out what happened to those adolescents during the COVID time. And we actually found out 4 different profiles, and those that have very high symptoms at the age of 17 were very likely to have more mental illness than those in other profile. And then we also identified one profile which is related to emotional regulation problems. We found out during the COVID time, those are the adolescents that were more likely to try to commit suicide. So I think that's a very important finding. So the next one, please. So in terms of the risk factors, there are a lot of that. So this is a summary of the literature out there. So being female, having cognitive dysfunction, experience life events, and there is also a family aggregation and environmental factors. So our work has focused quite a lot on environmental factors. Next slide, please. So that kind of led us to our work in cross-cultural psychology. So culture, as we see here, is defined by John Berry, and I think it has not changed much since then. It is a learn and share pattern of behavior, which is characterized of a group living within very definite boundaries, interacting socially among themselves. What is really important is the 2 aspects of culture, the explicit aspect and also the implicit aspect. So the implicit aspect is more the values, the beliefs and attitudes people have. Could you move to the next slide, please? And my interest in cross-cultural research is really to gear up, you know, what happened if we have an intervention. I'm sometimes quite nervous when I see colleagues in other culture, you know, trying to just simply translate, you know, the Western med intervention to other cultures without really taking into consideration about what's happening in their culture. So in terms of doing cross-culture in research, I'm very interested to find out, you know, are there any commonalities in terms of factors that lead to the development of anxiety? Do people have the, you know, different or similar explanation of anxiety, and what lead to help-seeking behavior? Because I think in our research seems to show that it's very much connected. And of course, one of the things that we have done quite a lot in the past was looking at the different theories that have been developed in Western countries and try to find out if we can generalize that to other cultures. Next one. Next slide, please. So one of the, I mentioned before, there is a family aggregation in anxiety disorders. So studies shows that if parents have anxiety disorders, the likelihood that the children have anxiety is up to 5 times higher. And from a psychological point of view, this is kind of the model that has been proposed and has been tested quite a lot, actually. So the transmission pathway is through parenting modeling and also through reinforcement of anxious behavior and through information learning. So that means that parents are actually communicating messages to their children about the danger and situations that should be avoided due to potential harm. There are a lot of studies, but because of time, I'm not going to go through all the studies. Yeah, so one of the studies, maybe next slide. Next slide. The order was kind of mixed. Yeah, not the next one. Before this one. No, okay, before. Yes, this one. Okay, so what we did here, the Hong Kong one. Yes, this one. So what we did was here, we compare, and also we compare the prevalence and also the correlates of anxiety in Germany and Hong Kong. And what we did was trying to test the theory about the transmission pathway. What we found in the German adolescents is that, you know, this tree model fit very nicely in the German model, but we cannot support that in the Hong Kong data. So what we found in the Hong Kong data is a very high correlation between competition to do well in schools and the level of anxiety that these young people have. So we don't really know what happened, and we think this is the reason why it might be the case. We thought it might be related to a cultural way of interacting, which makes learning model involving parent less salient in the Chinese culture. So in the Chinese culture, anxiety is very much related to the immediate, extrinsically driven pressure in learning and to compete. Whereas in the German culture, it's much more related to growing up experience in a family. And also this one, we have done quite a lot of work with our Japanese culture, looking at Taijin Kofushu. Taijin Kofushu is a very old concept. If you look at the history of psychiatry in Japan, it has already been written since the 1920s. So it's actually a disorder of fear of interpersonal relations. So it's a culture-bound syndrome to social phobia, but the focus is very different. So we see here the similarities involve fear of negative evaluation from others and avoidance of social situations. So the difference is that it's the focus, right? In social anxiety, the focus is on fear of embarrassing oneself, whereas in Taijin Kofushu, it is the fear that one's body parts and functions displease, embarrass, or are offensive to the others. Next one. So there are a lot of speculation why is it so different focus. So we have done quite a lot of work trying to find that out. But what we found is that, so we gave young people in England and the UK a different situation and then measure their anxiety level. But what we found here is that in Japan, the distinction between the different social anxiety situations are less outstanding than in the UK. Next one, please. Yeah, so in another study, this is a 2-generation study. It's actually 3-generation, but so far we managed to look at the adolescents and the parents. Instead, we also have data looking at the grandparents. But what we see here, so we measure the self-control concept. So independent is very much related to individualistic culture, and interdependent is very much related to collectivistic culture. But what this particular slide shows is that the adolescents in Japan are very much similar to the adolescents here in the West, whereas the parents are very much different. And we also see that highly correlated with Taijin Kofushu. Next one, please. Next slide. So what do we do? What do we know about cross-cultural research? So what we know is that there is cultural differences in the risk or correlates of anxiety. We also know that there certain behavior are more acceptable in other cultures than in some cultures. And the way we people cope with anxiety in different cultures are very, very different. There's also, you know, people manifest anxiety symptoms in different cultures. Is also very different. And actually it's quite interesting because people in different cultures have ways to help, you know, reduce anxiety. It's actually part of the way we live. But also something that we do in particular culture also, you know, try to trigger anxiety. I remember going to going to one of the schools in Asia last summer, and there was a big sign with 30 days, and I said, what is that 30 days mean? And it's actually reminding the students at that particular school is that there are 30 more days to a state exam, you know, so things like this. And we also know, for example, in some cultures, they would play music in the washroom, for example, so that when you are doing your business in the washroom, other people will not hear you. So this is something that is going on in a normal everyday life, which is part of the way we live, but there's also can be triggering anxiety, but also reducing anxiety. But when we talk about culture, we all often talk of culture as equal to countries, but that's actually not true, because even within the same family, you know, across the generation, there are differences as well. Get the next page, the next one, next slide. So in terms of mental health services utilization, this was the study we done many years ago. This study is actually quite interesting because this was conducted in Germany. The German health system is very comprehensive, and it's not a gatekeeper system. So that means you can go to any specialist you would like to. But what you can see here is, for those who have any anxiety, about 18.2% of them actually did seek treatment. So compared to the US data, which shows like 68% or 70%. So, so here on the right-hand side, we were looking at what are the factors that predict mental health utilization. So this includes things for anxiety. This includes things like suicidal attempt, age, comorbid disorders, and parental anxiety and depression. Next slide, please. So we know in childhood and adolescent anxiety, CBT is the treatment of choice. So across studies, there are about 60% of the children actually responded positively to CBT. But we know in some countries, especially in low resource setting, CBT is not easily accessible. What we also see is that almost all the programs are very disorder specific. Some of the intervention, like coping kit, is actually very long, so it is 18 to 24 per session. So in a lot of studies that we see a lot of high attrition, so it's partly because of the length of the intervention. And our own studies also show that there is a lot of discussion whether or not younger children could actually understand the basic concept of CBT because of their cognitive development. Next page, please. Next slide. So what we have been doing recently, well, recently is not quite recent, so it's about 6 years now. We have developed a program, a diagnostic program, which is called Superskills for Life. The reason for doing this is, you know, we see, as I showed before, there is a high comorbidity between anxiety and depression, and also the fact that, you know, smaller, younger children can have problem understanding the C part of CBT, the cognitive aspect. So we introduced the concept of behavior activation. Behavior activation was a very popular intervention for adolescent depression in the 70s. So it's really involving children to do sports, to do things that will give them positive reinforcement from the environment. And what I showed before is that you see there are common risk factors across disorders. So this includes low self-esteem, low, very poor social skills, and also cognitive dysfunction. And I think and it's not only anxiety and depression, these three risk factors are common across almost all disorders. Next one, please. Next slide. So this is our Superskills for Life. So it has different components. It has a component of cognitive behavior therapy. It's a behavior activation. We have a lot of social skills training in there, and we target core risk factors of comorbid disorders. But by coincidence, we also introduced this concept of video analysis and feedback. I said it's by coincidence because when we did a pilot study, I was very keen to have more objective measures of our intervention outcome by having children talk for 2 minutes before and after the intervention, because then I can look at more the behavioral indicators of anxiety. But then, even after the first session, children who never talk in class, who are very shy, their self-esteem just rocket up. You know, they start to talk, they start to put hands up in class according to the teacher. So we thought if that's the case, then we need to integrate that in our intervention. And only after we have started to analyze our data and did some literature review that we found out that, you know, other people that have done intervention with adults also did use video analysis. Next page, please. Next slide. So we have 4 versions of Superskills for Life. So we have the preschooler version, children, adolescents, and we just finished with the young adults version. It's meant for university students. So it can be implemented in group as well as an individual format. And there's a website here, and which will give you an update where in the world who's doing what there. So next page, please. Next one. So this is a study. I don't know how much time I still left, but this is actually just came out.
I think we're almost at time, so maybe about 2 or 3 more minutes.
Yeah, okay. So we have, this is the study we conducted in residential child institutions in Mauritius. So we have 2 groups, intervention and waitlist control. So we did this study in 6 different residential child institutions in Mauritius. So what we can see here is that we also did an executive function experiment here, looking at inhibitory control. So what we see here is we see a significant reduction in emotional and behavior problems. We see significant increase in adaptive emotion regulations. Next one, please. Next slide. Yeah, and this one is really interesting. This is a study we conducted with my colleagues in Spain, where we actually measure, you know, cardiac functioning of young people who participated in Superskills for Life. What you can see here, there is a significant reduction in recovery indexes after the intervention, which is really good. So for Superskill, we not only have the report, self-report questionnaires, but we also have, you know, measures of executive functioning. We also have measures of cardiac functioning as an outcome measure. Next one, please. Yeah, and this particular one is quite interesting because this was conducted by school staff. So because most of the study we conducted as a researchers, we go to school, but this one we work with Caritas Salford in Salford. I train every year 20 of their staff. So they're one of the things they did is really offering services to the different schools. So what we can see here is, again, we see significant reduction in SDQ and also increase in self-esteem, and we also have data on the video. Again, that it's very, very much similar to the one that we have in other countries. Next one, please. Yeah, so we have quite a lot of studies out there. So if anyone is interested, please let me know. Next one. Next slide, please. Yeah, okay, I will make this my last one. So I'm very interested. If you look this year, the World Mental Health 2020 motto was really greater investment, greater access, everyone, everywhere. So I am very interested, and a lot of my energy have been geared into promoting, disseminating super skills in low and upper middle income countries. I think the reason is that there's so much need and demand for mental health services, and some of the ideas in Western countries seems to be accepted. And I think, you know, with our research in cross-cultural psychology and how we can adapt it to make it culturally sensitive, I think, yeah, I think this is something that I'm hoping to continue to do. Okay, thank you very much.
Thank you.